절망의 땅이었으며 죽음의 땅이었습니다. 목마름으로 죽음을 기다리는 아프리카. 살기 위해 더러운 물을 마실 수밖에 없는 아프리카 차드. 심지어 갈등보다도 배고픔이 더 커서 죽는 줄 알면서도 살기 위해 무작정 더러운 물을 마셔야 하는 어린아이들. 맑은 물이 나올 때 이제 아이들이 물을 마음껏 마실 수 있겠구나 하는 감사의 마음이 흘렀습니다. 물을 마시며 웃는 아이들의 모습을 보면서 죽음의 땅이 소망의 땅이 될 것 같은 믿음이 생겼습니다. 지구 반대편에서 쉽게 물을 마시고 살아가는 우리도 이 아이들의 소망이 될 수 있다는 것을 알았습니다. 소망물은 그곳의 아이들에게 소망을 심어주었습니다. 여러분들이 바로 이 아이들에게 참 희망이 될 수 있습니다. 글을 배우고 새로운 환경의 변화를 맞이하는 이 아이들을 보면서 희망으로 다시 일어서는 아프리카 차드의 미래가 있음을 느꼈습니다. 아프리카 차드는 이제 더 이상 물로 인해 고통을 받지 않고 그를 몰라 소망을 잃지 않을 것입니다. 바로 이 아이들이 아프리카 차드의 미래이니까요.
도움 주실 수 있는 분들은 많이 도와주셨으면 감사하겠습니다. 이번에는 임할희 선생님께서 나오셔가지고요. Nephrology Nursing Gateway to Health and Normal Life for Renal Patients에 대한 강의를 해주시겠습니다. 임할희 선생님께서는 시카고에서 오셨고요. 지난해까지 굉장히 시카고 간호협회에서 많은 일을 하시고 회장과 이사장을 하면서 수고하실 겁니다. 감사합니다.
I'm very honored to be here today to talk about the nephrology nursing, 신장간호, kidney disease before 1950s. Because of high mortality and morbidity, used to be a fatal disease. 죽는 병으로 생각했는데, because of the dialysis and kidney transplantation, it's no more. Okay, so go next. The nephrology nursing is a specialized 특수 분야에 있어요. 그래서 dedicated for patients in chronic and acute kidney failure patients and their family. 그리고 nephrology nurse work as a team with the nephrologists, social workers, dietitians, and engineering, biomed engineering, and so on. 그리고 nephrology nurse work as inpatient dialysis, hospital-based clinic centers, and transplantation unit, and outpatient 외래에서도 많이 하고 있어요. 그리고 home-based training, patients and also their families. Look at anatomy of kidney. Blood comes from aorta. 그래서 대동맥에서 와서 그 kidney 들어가서 renal artery and vein 들어가가지고 그래서 그 main kidney functioning, filtering and purification of the blood, waste products and excessive water. The end product is the urine. 보통 우리가 normal kidney 필터가 거의 180L, 180L 그 피를 프로듀스 하면서 1L 프로듀스한 유린이 한 1L에서 1.5L to produce urine. 그리고 the kidney is so efficient. Even if one kidney is removed or non-functioning, still works as a normal person. So 그래서 도너가 한 키드니를 주시더라도 그 살아가시는 데는 아무런 지장이 없다는 겁니다. What do our kidneys do? Kidney is a very important organ. Size is a human adult fist size and pin shape. Located on spine, just above your waist. Okay. Organs are very responsible for body functions necessary for life. Cleaning blood and excess fluid and chemical balance, pH, acid and base balance, and red blood cell produce, healthy red blood cell. Kidney makes a lot of hormones. One hormone is erythropoietin. Erythropoietin goes to bone marrow to stimulate bone marrow, make a red blood cell. Okay. Play role in the control of blood pressure. Also another hormone is kidney makes another hormone, renal, angiotensin, and aldosterone kind of things to control blood pressure. That system, okay. 그리고 produce vitamin D for bone health. Vitamin D is responsible to absorb calcium in your body. Calcium. So if it's no abnormality of calcium, vitamin D creates low calcium level in your blood and overproduction of your parathyroid hormone, parathyroid PTH hormone. So in order to compensate the calcium, so the parathyroid hormone take out the calcium from the bone. So people get all the fragile, bone weak and fragile, and finally get the bone disease. Okay. Manifestation of renal failure. Renal failure, I mean acute renal failure and chronic renal failure. acute renal failure, acute kidney injury, usually they say reversible, sudden deterioration of the kidney function because of the accident and the complicated surgery or infection, severe infection, okay, or nephrotoxic, it's like certain antibiotics and the drug overdose, but usually reversible. They call acute kidney injury. Chronic is they consider end-stage renal failure. Gradual, very slow and progress renal function, most commonly by the 당뇨, hypertension, usually in polycystic kidney, immunologic disorder, it's like a lupus. But it's usually it's almost always irreversible. Once the kidney is chronic, it cannot work less than the GFR, the kidney function is less than 50%. You have to go either dialysis or kidney transplantation. Mortality rate, otherwise mortality rate is 100%. But initial goal is not going dialysis right away. Either, you go preserve kidney. Initial treatment goal is to preserve the kidney function as long as possible. So it's ideology depends on what kind of what it's diabetes or hypertension and whatever the causes, they follow the etiology. Hemodialysis is a 심장투석, 심장투석에도 종류가 있는데 이거는 혈액투석입니다. hemodialysis. 키드니, 이거를 인공심장이거든요. 인공심장. Kidney dialysis machine imitates our renal function, function of human kidney function, using the principle osmosis and the diffusion. Like this is a blood line. Blood comes, they have two different lines. Blood comes here, and the 투석물 comes here. So they work the opposite current flow. Out, 반대로 와서 그렇게 working under principle of diffusion osmosis. High concentration goes to low concentration. Usually the blood goes to dialysate, 투석물에 가서 그렇게 low molecular weight. It's like our human waste products. It's a creatinine, uric acid, and excessive waste products. Water goes to filter out. But high molecular, more than 150, high molecular weight, it doesn't pass easily. Through the semi-permeable, it is 인공심장 has a lots of bundle of the semi-permeable, 반투막 hollow fiber로 돼 있어요. 그래서 이렇게 they pass easily, they dialyze out, in and out, they call it. So in other words, the human kidney works in nephrons, filtering nephron, our the million nephrons 있는데 이거는 in the human kidney's nephron works, but this one is artificial kidney replace the nephron, replace the nephron. That's in other words, the 원리 is 그런 식으로. Main thing is diffusion and osmosis. High concentrate solute goes to low concentrate in the water. They work. The basic principle is like this. Okay, so it's okay. So in order to dialyze the patient, you need access. This is a typical 3-axis, but it's a vascular. It's a peripheral vein is not good enough to pump the 400 cc per minute. You need, in order to have a good dialysis, you have to have at least 400 cc per minute. So this is left side is a vascular catheter, and in the middle is 동맥과 정맥을 join한 authorized venous fistula or graft they call. So it's The left, the catheter has several kinds. The most preferred is intrajugular, as you see the picture. Intrajugular is the most preferred. Used to be subclavian, but subclavian gave too much complication since the lung was too close to subclavian, so get a lot of times pneumothorax, or venous stenosis. That's why they don't use it anymore. So they use the most is the IJ, best cat is intrajugular, or femoral catheter. So either they can use either temporary catheter or permanent, like for chronic patients. They use it their way. In the middle is, they call it a typical forearm AV fistula or graft. Fistula is the own vein and artery connected by vascular surgeon, taking out blood through dialysis, and then return blood back again. Another one is arterialized AV graft. People who has no own vein or vessel, they put an artificial vessel. They call graft. It's a synthetic tube. They put in their way. About 400. In order to have a good dialysis clean, at least blood pump should have a 400 cc per minute. On the right side is just lately introduced. They call hero graft. This is a final resource after all the vascular catheter or forearm, the AV fistula graft, all exhausted. If they don't have a choice, they go this one, like a device, they call it vascular implant device, like a graft, but a different way, through the veno cava. They go. So even not every place is using this one as a hero graft. Even our hospital is not using it. Okay, hemodialysis machine, past and present. Left, as you see, left is 1960. The first patient, hemodialysis, repeated hemodialysis patient was University of Washington in Seattle. Right side is the present, what we are using. This axis is upper arm brachial, usually brachial artery and the basilic vein. They joined by the vascular surgeon. Taking out blood, and blood goes to here. Blood goes to here, to down. And then it's the kona혈액투석Nephrology, the port going to from here to top. Counter current, 반대방향, the working the opposite way by the principle is osmosis and diffusion. Good thing is 1994, U.S. Congress passed the law for end-stage renal disease patient program, funded 80% by Medicare, but 20% is either go private insurance or public aid. So the financial situation is very important for this patient. Peritoneal dialysis. This is another alternative treatment ESRD patients. This 복막투석 is this is like a person who cannot tolerate the hemodialysis. Hemodialysis is 혈액투석 is kind of the fluid shift is too fast. It's like 3-4 hours. You remove sometimes 3-4 liters. Some people cannot tolerate that kind of treatment. So sometimes they choose the peritoneal dialysis through the peritoneum. The semiplembrane bantumak is peritoneum. That's why you need a good. No, you shouldn't have a scar in your belly or bowel disease. You shouldn't have any problem bowels. It's abdominal.